Hello, and welcome to our channel. I'm your host, Daniel. 5 years ago today, Malaysia confirmed its first COVID-19 case. Hospitals overflowed, heroes emerged, and the world applauded. But today, those heroes are fighting a new battle. One against broken promises, burnout, and a system that forgot them. In this episode, we're revisiting the pandemic's darkest days to ask, what happened to the healthcare workers who saved us? Why are they leaving in droves? And what does this mean for the future of healthcare? Let's dive in. Imagine working 18-hour shifts in suffocating PPE, watching patients die alone, and sleeping in your car to protect your family. This was daily life for healthcare workers during COVID-19. Nurses broke down after exposure to the virus. Doctors developed facial ulcers from tight masks. And yet, not a single colleague refused to work. But the trauma didn't end with the pandemic. Today, Malaysia's healthcare system is collapsing. Houseman appointments have dropped by 50% since 2019. Over 3,000 contract medical officers resigned between 2021 to 2023. Nurses, earning stagnant salaries as low as RM 2,600, are fleeing to Singapore or Dubai. The pandemic didn't just strain hospitals. It shattered the people who held them together. But the challenges didn't end with long hours or PPE shortages. Let's talk about what happened after the applause faded. During the pandemic, politicians promised permanent positions, better pay, and support. 5 years later, most of those promises are unfulfilled. Contract doctors face mandatory relocations if they accept permanent roles, pushing many to quit instead. Nurses work 45-hour weeks with no additional leave. Worse, workplace bullying and a toxic culture persist. A 2022 task force collected 14,000 pages of testimony from healthcare workers detailing abuse and exploitation. But the findings were buried. As one emergency doctor wrote, "We answered the call when the nation needed us. Now, we're left with sleepless nights, emotional scars, and a system that exploits our sacrifice." So, what's driving this exodus? Let's break it down. Malaysia's nurse-to-population ratio is 3.6 per 1,000, far below the OECD average of 9.2. Doctors in training juggle dual roles as housemen and medical officers. Specialists resign at record rates, with resignations up 57% since 2019. The root cause? A mix of bureaucratic inertia, low pay, and a culture that romanticizes suffering. As one nurse put it, "We don't complain, we just leave." The pandemic exposed these flaws, but instead of fixing them, the system doubled down. Healthcare workers now face violence from patients, staffing shortages, and a public that's moved on. 5 years after COVID, Malaysia's healthcare heroes are exhausted, undervalued, and vanishing. If we lose them, who will save us in the next crisis? If this episode moved you, share it with someone. Let's demand better for those who gave us everything. Next week, we'll explore solutions. How can we rebuild a system that protects its workers? Until then, stay safe. And remember, healthcare heroes deserve more than just gratitude. They deserve change. This is Daniel, signing off. Thank you for listening, and please share and subscribe if you enjoyed this episode.